My name is Klaewsongkram. I'm an allergist and clinical immunologist at the Department of Medicine, Faculty of Medicine, Chulalongkorn University in Bangkok. I would like to present our study about the role of in vitro tests to confirm diagnosis of allopurinol-induced severe cutaneous adverse reactions. The reason why we did this study because allopurinol is one of the most common drugs that causing severe cutaneous adverse reaction or scars worldwide. And since drug rechallenge in patients with a history of scar is contraindicated, the study was to determine the value of interferon gamma ensembling immunospot or ELISpot assay as a confirmation test in patients with a history of allopurinol-induced scar. Peripheral blood mononuclear cells or PBMCs from 24 patients with a history of allopurinol-induced scar, 13 DRESS, 11 Stevens-Johnson syndrome or TN, and 21 control subjects who were tolerant to allopurinol or allergic to other drugs were incubated with allopurinol or oxypurinol in the presence or absence of anti-program death ligand 1 antibody. The frequencies of interferon gamma releasing cells after incubating with different stimulatory panels were subsequently measured with ELISpot assay. The RC curve analysis were performed to determine the optimal cutoff value of interferon gamma releasing cells to confirm diagnosis of allopurinol hypersensitivity. We found that oxypurinol-specific interferon gamma releasing cells were detected in allopurinol-induced scar patients and significantly increased with anti-PD-L1 supplementation. The frequencies of interferon gamma releasing cells in allopurinol allergic patients are much higher than those in the control group when stimulating PBMCs with oxypurinol plus anti-PD-L1 or with oxypurinol alone. According to the RC curve analysis, the best discrimination power of interferon gamma ELISpot in confirming a diagnosis of allopurinol-induced scars can be achieved by using 16 spot-forming cells per million PBMCs as a cutoff value upon stimulation with oxypurinol plus anti-PD-L1. Regarding the factors influencing the interferon gamma enhancing effect of anti-PD-L1, the enhancing effect of anti-PD-L1 in allopurinol hypersensitivity is significantly demonstrated in DRESS patients, in those in active stage of drug reactions, and those with concurrent systemic steroid use. Our study reveals that the measurement of interferon gamma releasing cells upon stimulation with oxypurinol plus anti-PD-1 antibody is a useful tool to confirm diagnosis of allopurinol hypersensitivity. In conclusion, the measurement of oxypurinol plus anti-PD-1 inducing interferon gamma releasing cells can use a high diagnostic value in distinguishing between allopurinol allergic patients and control individuals and is beneficial in confirming a diagnosis of allopurinol inducing scar in patients whose allergic reaction develops while taking multiple drugs.